Jenna, thank you so much for meeting with me today. I just actually wanted to ask you some questions like, how you think the rotation's going.
Sure. I think it's going great. I think the team's really jiving together really well. We seem to all kind of be on the same page. I'm really loving my time here so far.
That is so great. And, it's such a hardworking team. And I know you're such a hard worker. Have you noted any issues around patient care, or you have questions sometimes about management of patients and wondering anything like that?
I mean, I think sometimes, I ask my junior resident some questions when I'm like trying to figure things out. But I overall think that we're all kind of making the right decisions and the patients don't seem to be harmed in any way. So I think we're doing okay.
Do you ever hesitate to ask, for help? Do you think anything like that?
Not really.
Okay.
I think that sometimes maybe if some people are really busy, but usually, no problems whatsoever.
Okay. Do you feel like your team would be supportive if you did ask for help?
I think so.
Okay. Yeah. Okay. No, I think they are. I think they would be. Yeah. Great. So no issues at all. You're really comfortable with your role and how much help you have. You good with that?
Yeah. I mean, I think, the hours are long and that can be tiring. But overall, I think things have been going pretty well.
Well, it is really true that you have been just such a hard worker, and I think the team, it's a great team. So okay. Well, I just, I think sometimes I like to touch base with the interns, and I just want to see how you were doing and make sure everything seems okay from your point of view.
Yeah, I think things are going great. So thanks. I appreciate you sitting down with me.
Okay. And you'll come to me if you have any problems or issues, yeah?
Yeah.
Okay.
Sure.
All right. Okay. Well, thank you for meeting with me.
Thanks.
Okay.
Wow. I must be doing really well in this rotation.
I'm really not sure she understood the problem. I tried to ask her questions about the specifics around getting help, but I don't think she really understands the issue. I really don't think that went too well. So this was an example of what we call non-judgmental feedback, which is a feedback where we try to get the feedback receiver to guess, essentially, or to come up with the problem herself. And it's done for a compassionate reason, which is that we're uncomfortable saying the problem, being specific about what it is. So we're hoping that if we give enough room and ask enough questions, that the person will come to the realization herself as to what the problem is, and then we're more comfortable talking about it. As you can see, the problem with that is many times people who are having issues and you are trying to give feedback about them don't know what the problem is. They don't have the insight into it. And you can really ask all day and they're not going to come up with the problem. So it's actually, though it comes from a good place of not wanting to hurt someone's feelings, it actually really doesn't get the job done. And for that reason, it's really not recommended. And the reason we quote non-judgmental is that, in fact, when we are giving critical feedback, it is a judgment. We're not judging the whole person, but we are judging her behavior. And that's okay. That is part of our job as supervisors, as educators, as colleagues, is we do have a view, and that's why we're in the role we're in. That's part of teaching and training. And so it's a myth that when you're going to give feedback, it shouldn't be judgmental.